Good morning and welcome to StantonMD. I'm board-certified emergency physician Dr. Ryan Stanton. Today we're talking about giving back. I think we all realize the cost and impact of healthcare. One of the greatest slices of the federal budget and a growing economic concern for physicians, patients, and legislators. Over the last number of years, the number of uninsured has dropped, but the number of underinsured has exploded with rising premiums, drops in coverage, and huge deductibles. Many Americans are finding that their coverage is in name only. The underinsured have potential health care obligations that far outpace their income and savings. Thus, they are left with the options to avoid care or face huge bills that could result in financial collapse and bankruptcy. The largest growing population of the underinsured is the working poor and middle class, those that may make enough money to not qualify for all government services, but don't have the funds to build large reserves for expenses outside daily obligations. These folks are falling through the cracks in growing numbers, facing the choice of bankruptcy or ignoring medical needs. We spent time with two services that help fill in that gap, taking care of patients that may not have the access to the care they need when they need it. We spend time with Surgery on Sunday, a service that provides outpatient surgeries at no cost to those in need. Then we go to the Refuge Clinic, a clinic in service for working, uninsured, or underinsured so they can meet their primary care and preventive health needs. Finally, we're going to shift gears, talk about the recovery from joint surgeries and injuries with KORT Physical Therapy, helping folks get back on their feet, advance recovery, and prevent future painful conditions. But first, we start off with Surgery on Sunday.
Surgery on Sunday is exactly as its name suggests. It's a full outpatient surgical service that takes place on one Sunday a month. During their time, they perform 15 or more surgeries in 4 hours in children and adults alike. The clinic is staffed just like any other surgery center, with nurses, doctors, techs, and clerical services. They're all there as volunteers, and the surgeries cost the patients nothing. For many, this service can mean the difference between losing everything and continuing towards that American dream. Dr. Andrew Moore is the founder of Surgery on Sunday and explains how a personal belief became a reality.
I've always believed that we needed to give back to society, and there were people less fortunate in our society that needed help. So I sort of went into medicine with that idea. My father was like that, my grandfather was like that as well. And so I always took care of people that didn't have money and found ways to do that.
Dr. Paul Carney is a highly respected surgeon and the medical director for Surgery on Sunday.
Well, the concept for Surgery on Sunday is a fairly straightforward one. There are lots of underinsured or uninsured members of our community. And no matter how big the reach is of government programs or local insurance programs, you're never going to be able to pay for a lot of people. There's people that just simply slip through the cracks for one reason or another. They're not eligible, they're working poor, and they have needs. They have the same medical and surgical needs that the rest of us have. And Surgery on Sunday was sort of an avenue to provide services for those people to put them back into the workforce.
The key clientele for Surgery on Sunday is that growing population of underinsured or uninsured.
Well, there's no question that patients are falling through the cracks. And when we started this, there was probably about 20% of the state that was uninsured. With Obamacare, that dropped down to about 8.5%. But unfortunately, a lot of people that were on Obamacare, as you well know, have huge deductibles. Maybe $6,000 for an individual and $14,000 for a family. Well, when you have those types of deductibles, you really don't have access to health care because you can't afford the premiums, much less those kinds of deductibles.
The challenge for Dr. Moore wasn't the motivation or the idea, it was making that idea into reality in an industry that is highly regulated, with federal and state laws that seem to make the goal of helping people for free very challenging.
Probably starting, 15, 17 years ago, I made a couple attempts at starting something like Surgery on Sunday. My idea was that most of the ORs are kind of closed down on Sunday, and that would be a good time to do it. But I really didn't have all the talent to really make it happen. And through the years, I eventually surrounded myself with the right people that could take care of my shortcomings and make it happen.
Thankfully, Dr. Moore saw the project through, and now thousands have had surgeries through their services. Dr. Carney tells us how it is all put together on any given Sunday.
It required some infrastructure building in order to do something this complex. So it took a number of years to put all of the pieces in place. You needed a surgery center where you could operate. You needed volunteers who had the expertise to do that. You had to have coordinating individuals that could screen and clear patients and take care of their other medical problems to make sure it was safe for us to operate on them. And then finally, you needed a group of specialists in the surgical fields who were willing to come in and operate on these patients.
The question is why? What is the motivation for Dr. Moore and his staff to give up a Sunday morning to do what they do during the rest of the week, but for free?
There's certainly been times and periods in my life where I needed somebody to help me do something that I wanted done, or needed help personally to accomplish things that I wanted to do in life, and people have helped me. And I feel like I need to do that as well. And the joy that you get out of doing something like this, helping somebody that otherwise wouldn't be helped, it's hard to duplicate that life with other things that you do. I mean, when you leave this place on Sunday, you feel great. If you look around here today, you see everybody's got smiles on their face. They're not at work. They're here doing something that they have a real passion for, and they love it, And I mean, even when I'm not operating, I come over here on those Sundays so I can be around this group of people that are just so excited to be here, and they make it happen. We have about 80 volunteers that are here that make this happen. So there's a lot of work behind the scenes that makes it possible for us to do this.
And as a result, dozens show up on Sundays to provide care for those in need.
Everybody wants to be here, which is great. So today would be a sort of a typical day for us, and I don't know how many cases we have today, but it's around 15 or 16 cases, which is a sort of a typical Sunday for us.
So how big is surgery on Sunday? Every surgery day, nearly 100 volunteers spend the morning providing anywhere from a handful to over 15 surgeries to patients of all ages. Over time, the numbers have added up.
We've been running since 05 or 06, and we've done about over 6,000 outpatient surgical procedures in that 10-year span.
And the cost to these patients?
None. The patients do not pay a penny. So not only do we get their preoperative evaluation at no cost, any diagnostic studies they need are done at no cost. Medications they might potentially need are all done at no cost to the patient. So it's totally free at every level.
Most of these people are hardworking citizens. They're taxpayers. Some own small homes and cars and have families, and they just need that little bit of help to get back into the flow of things, and that's what we're here to do.
To these patients, this service is the difference between potentially insurmountable medical bills and getting back to life or work as soon as possible. To them, it's about family and being a functional member of society.
Most of these people are unable to work, so the family's struggling financially. Sometimes they're unable to take care of their children or other household needs. And again, we get them back into the family situation, and the whole family is stressed out with this illness and sickness. And when you change that, you really change the whole perspective of how that family relates to each other.
Let's just take a simple outpatient surgical procedure. The cost of a simple outpatient surgical procedure, let's say a hernia repair, a gallbladder, or ear tubes for a young child or something along those lines. The average outpatient cost is right around $20,000. Think about that for just a second. $20,000 for somebody who might be making $25,000 or $30,000 a year, can't afford insurance, doesn't qualify for Medicaid. I mean, that's just an untenable financial burden. So we take a cost for a simple outpatient surgical procedure, which may be $15,000 to $20,000. We make it zero for the patient.
As you walk around surgery on Sunday, there are smiles everywhere on the faces of the volunteers, patients, and families. This service is one of the compassions and commitments to people in the community. You can learn more about Surgery on Sunday at their website, surgeryonsunday.org. More StantonMD coming up. Stay with us.
This is Jerry Eves for KORT Physical Therapy. Getting to physical therapy can be tough, but it doesn't have to be. KORT's home physical therapy program can help you heal faster after surgery. Here is how. A KORT physical therapist will come to your home within 24 to 48 hours after surgery, even on weekends. They will establish a home exercise plan until the patient is able to transition to KORT's outpatient clinic. They will educate and collaborate with the patient, which is critical to a patient's well-being. For more information on how KORT comes to you, visit KORT, KORT.com. KORT has over 50 locations. Check out KORT, KORT.com.
Primary care and a good family doctor seem like a given in modern medicine, but for millions, access to care is nothing more than a pipe dream. With the Affordable Care Act, millions of patients received access to insurance, but that didn't mean access to care. In fact, it has exacerbated an entirely different problem. Now, millions of hardworking Americans are finding that they are underinsured as insurance premiums rise and deductibles skyrocket. There's also a growing shortage of primary care physicians to care for these patients, a product of growing overhead cost, reduced reimbursements, increased and overly burdensome regulations, and frankly, a system that just can't keep up with the growing demand. One answer is the Refuge Clinic. This clinic serves those in central Kentucky and surrounding areas. As an outreach of Southland Christian Church, it has filled a growing gap in the U.S. healthcare system. Rachel Smith is the executive director of the Refuge Clinic and outlines the vision and mission of the clinic.
I serve as the executive director, and I've been fortunate enough to be here from the very beginning. So about 9 years ago, there was a vision that we wanted to take the church outside the walls and respond to the needs in the community. And at that time, I was able to come on and help out kind of creating the clinics and seeing what the true need was in the healthcare arena at that time. And so that's kind of been my role ever since.
Whereas there are options for those on both ends of the income spectrum, a growing need is those working-class, blue-collar Americans that may be making ends meet, but not to the point that they can keep up with the growing costs of the healthcare system.
The Refuge Clinic exists to treat the community and the needs in the community. And so when we started about 9 years ago, there were millions of people that were uninsured, and at the time it was really challenging to find a provider and to be seen and to be treated at a costly, affordable rate. Now we saw with the change of the Affordable Care Act, we were excited and we were like, oh, there's an opportunity here for people to receive care, but then the issue switched where it was access to care. There weren't providers that were taking the insurance that was available, and so when we decided that we were going to see only uninsured, we had to change that to say, well, the need that we see in the community now really is for those that are underinsured.
She also notes that one of the great aspects of the Refuge Clinic is that the physicians, nurses, and providers are not bound by the typical pressures of the clinic setting, and thus can approach healthcare in a different way.
The Refuge Clinic is different in the sense that we do relational healthcare. We believe that to really see health, you have to treat all components of a person. And so we want to invest in people, not only in their physical well-being, but also their spiritual and their mental health as well. And so we do a very comprehensive approach with a team of lots of different volunteers.
And there is no shortage of demand.
Since we began, we've taken on the care of over 3,500 patients. Currently, we're taking on the care of about 2,000 patients.
This model seems obvious, that you would expect to see it in every community, filling the gaps in a broken system. This is not the case, unfortunately, but Rachel thinks it could happen.
I think that there's an opportunity for other people to continue this type of model, whether it's through a partnership with their local church, or whether it's just a group of volunteers that say, you know, we have a combined passion and heart and we want to respond. Everything that we do here is through the work of volunteers. So I can already attest to the fact that there are hundreds in our community that have a passion and desire to care for others. And I know that our community is special, but I know that other communities have that similar passion. And so I think that people just engaging in a unified response would really be able to create things like this in more areas.
Dr. Donna Stanton is a physician volunteer at the Refuge Clinic.
I'm board certified in internal medicine and pediatrics.
She has her own practice and clinic schedule, but regularly can be found in the Refuge Clinic, caring for patients that otherwise could fall through the cracks.
I like what the Refuge Clinic provides to the community, which is kind of filling in the gap for those patients that work hard but may not have access to appropriate or adequate health care and insurance.
Though there are many volunteers from all aspects of healthcare and beyond, it is often hard work to advocate for the patients and get them the help they need.
So we have staff here that works full-time trying to get those procedures done for the patient in an affordable way. Also, we depend on volunteer, pro bono donations, reduced cost benefits through some facilities.
One of her patients is Faith. She has been seeing Dr. Stanton and others for several years.
At the time, I had no insurance, wasn't feeling great at all, nowhere to really go, couldn't afford to go to a doctor's office to see what was wrong, and a family member of mine had told me, hey, we heard of this place, maybe they can help you, I don't know, here's the number, at least go and try and see. I called, they scheduled me very, very quickly.
From her lowest of lows, Faith now understands what the Refuge Clinic has meant for her and her health.
For just the opportunity just to come in and meet with a doctor and tell them what was going on, I truly don't believe that I would be here today.
You see, when Faith started going to the Refuge Clinic, she was morbidly obese, barely able to walk across the room without becoming short of breath. She had congestive heart failure, high cholesterol, high blood pressure, and diabetes, diagnoses that would surely lead to an early death if not treated. Over the years, much has changed, and she credits that to the Refuge Clinic and to how it's a different clinic from what she's seen in the past.
You are at a place where you can just lay it all to the side and just, it's just like a release. It's just the love. I mean, it's truly just the love of God that has poured over into these people that just make the atmosphere just completely different than any place I've ever been. Even had, you know, at one point in time, never, and I brag about this to this day, that a doctor came to my house because I wasn't feeling great, just to see how I was doing, and what doctor makes house calls in 2017.
The Refuge Clinic has cared for Faith, helping her understand and tackle many issues and improve her health. She repeatedly voiced gratitude and appreciation for those that staff the clinic.
It just seeing that, you know, they're taking the time out of their lives from their families, investing into people that they don't know to make them get to a point where they feel better, and not just sickness, whatever, but just on the inside, like really, truly on the inside. If it wasn't for if it wasn't for them, wow, I would probably still be I'd probably still be stuck on my couch, not able to walk from my couch to my door without being out of breath.
With the help of the Refuge Clinic and others that donated services, Faith has lost over 150 pounds and no longer has heart failure, diabetes, or high blood pressure. She is now pursuing her dream of attending college in hopes that one day she can give back just like those that have given so much for her.
I do. I appreciate it. I do. Just love you. I love you too.
Surgery on Sunday and the Refuge Clinic are both models that we should be seeing throughout the country. It takes volunteers from all levels, motivation, relationships, and donations to make these projects happen. It can also be assisted by legislators willing to think outside the box to empower those in our communities to do what's right for our neighbors and fellow citizens. If you or others in your community are interested in volunteering with these organizations or want to establish similar clinics in your own community, I invite you to reach out to us here at StantonMD, and we can help you get in touch with those that can make this happen. Contact us, info@StantonMD.com. More StantonMD coming up. Stay with us.
Do you own or work for a business that advances health and safety of the public or its employees? Then you may be interested in becoming a sponsor of StantonMD. There are various opportunities for sponsorship, from the show to the website, social media, print, or a combination. For more information on becoming part of StantonMD, contact Jen at info@StantonMD.com. That's info@StantonMD.com. Now, back to the show.
Welcome back. One of the most effective and yet underutilized therapies for painful conditions, injuries, and surgeries is physical therapy. In an era where powerful pain medications seem to be the standard, driven to our country's worst substance abuse epidemic, many inside and outside healthcare look for safe and effective answers. Physical therapy is an answer that's been there for decades, helping patients recover after surgical procedures. More and more research is showing the benefits of PT on many painful conditions, including joint surgeries, periods of immobility, degenerative conditions, and injuries, whether acute or chronic. Not only can physical therapy improve recovery, it can decrease future injuries, pain, and setbacks.
At KORT Physical Therapy, they work with patients throughout their recovery to maximize functional wellness and decrease pain. One of their biggest businesses is the in-home physical therapy, which they call Outreach Program. This service is designed to evaluate the home and assist in the early recovery phases after joint replacements and complex surgeries. Whitney DeWeese is the coordinator for the KORT Outreach Program.
I've been a physical therapist for over 5.5 years, and the past September 2015, we started an outreach program, which is really geared towards patients who are just not quite ready to get into the outpatient clinic. Those patients may be knee replacements, hip replacements, overall just joint replacements. We also have patients who may be at fall risk, which need a little bit of finesse in their gait and their ambulation and how they walk.
There are basically 3 phases of physical therapy for recovery from surgical procedures. This is the hospital setting, the home setting, and finally the outpatient clinic setting. The earliest phase is in the hospital, right after surgery, helping the patient in the immediate postoperative period. After discharge, the physical therapy moves to the home, as the patient needs to continue that recovery, but is not to the point that they can easily and practically make it into the outpatient therapy clinic setting. Rob Swayze is a physical therapist and the coordinator for one of KORT's outpatient clinics. He explains why it's important for them to be involved early and throughout the recovery phases.
So if you have surgery, say for a total knee, total hip, especially a total knee, there's a certain amount of time where you can only get a range of motion. And if we don't get it within a certain amount of time, you will get a stiff knee. I like to call it the wet cement phase. Every day that goes by, the cement gets a little bit drier, harder to get. So our role is to make sure that they're on track to get that motion as quickly as possible.
The home setting is an important consideration for the therapist because it's where the patient will spend most of their time and will present many of the challenges and potential setbacks the patient will experience.
I really think with joint replacements specifically, patients have so many questions about what to do next. Okay, now I'm home. How do I get everything started? So that's one of the real benefits of us being able to go into their homes, because most of the time they're not ready to come out in the environment. It's just going to be too much for them to get dressed and ready in the car, out of the car. So it's really good for us to see them in their own environment, try to give them things that they can work with at home to progress their function.
Laura Williams is another KORT physical therapist and also participates in the outreach program.
Just trying to, recover from the surgery, but also kind of work on things that they need to work on to help progress them. But I think it really kind of hopefully helps kind of calm people's fears a little bit, so they don't have to feel like, oh, I've got to go into this gym environment and do all these exercises. But if somebody can come to my home, I'm more comfortable here, and I'm probably going to recover better that way.
The outreach program not only provides the patient with the early physical therapy that they need, it also evaluates the house for unique challenges, understanding what the patients will be experiencing on a daily basis throughout their recovery.
The biggest thing is for me to just go in and almost think that the patient isn't aware of anything. So I try to go step by step. What's going to be safe for you? What's going to be safe when you get in and out of the bed? Walking to from the bathroom in the middle of the night. So different things like that. We want to make sure that they're fully aware, because sometimes we assume that they may be knowledgeable about certain things, but that's not always the case. And just little things like turning on the light or a night light during the night when they're ambulating, getting up to the bathroom, or securing their toilet. So the biggest thing is for me to just go in and almost think that the patient isn't aware of anything. So I try to go step by step. What's going to be safe for you? What's going to be safe when you get in and out of the bed? Walking to from the bathroom in the middle of the night. So different things like that. We want to make sure that they're fully aware, because sometimes we assume that they may be knowledgeable about certain things, but that's not always the case. And just little things like turning on the light or a night light during the night when they're ambulating, getting up to the bathroom, securing their toilet next to the bed, the potty chair, things like that can make a huge difference as far as patient safety, especially when they get up the first few times, because they're so unaware of what's going to happen with their joint.
The keys are to promote recovery and safety. Some easy tips for you are to clear walkways of tripping hazards, use assistance devices that are indicated, and avoiding one of the most common pitfalls that land people in the emergency room, turning on the lights when walking around at night, especially when making your way to the restroom or bedside commode. Whitney notes that it is this attention, education, and assistance that promotes recovery and patients' value.
The patient really appreciates us understanding, this is my challenge, these are my challenges, and we strive to get those patients more comfortable, feel more secure and confident in what they're trying to do.
As an emergency physician, I feel that physical therapy is one of the most underutilized tools for the recovery from injuries and painful conditions. Whether it's after a major surgery, a work-related injury, or the exacerbation of chronic painful conditions, physical therapy can help get you back on your feet, increase mobility, and promote future health and wellness. And that's all the time we have for this episode of StantonMD. If you missed an episode or want to watch a segment again, check out our website, StantonMD.com. I also invite you to join our community by liking the StantonMD Facebook page and following me on Twitter @EverydayMed. We welcome comments and suggestions. Email us, info@StantonMD.com. Until next time, I'm Dr. Ryan Stanton, and this has been StantonMD.